My name is Flemming. I am from LineIn, and we offer human call handling services to primary care and other healthcare settings.
And I'm Nikos. I am from Auxilis.ai, and we offer Jackie, that is an AI receptionist for primary care, but we also do have offerings for other healthcare settings.
What's interesting is that you have the AI call handler or call agent. We have a human agent, and we should be worried about you, shouldn't we?
Well, yeah, but that's only if you think about the means of achieving a goal rather than the goal itself, right? We're both trying to make things better for GP practices. And the question is, how can we provide the best service to the GP practices and their patients? And that is probably better served at this point with a combination of the two aspects, the AI and the human.
And I mean, you've seen my model, and you've seen how I believe as well, just like you, and which is why we work together now, is that we believe in that dual approach. So when patients say approach the practice, there is like a synergy between the human and the AI.
Absolutely. And there's a lot of aspects to that. First of all, we have to be honest that AI is not for everyone, right? So 10% of the patients actually do not like to speak to AI bots. But then the thing is that how can we make healthcare better for everyone, regardless of what is their preference of how they're getting the service? And if you do handle the 90% of the calls with AI, then the more complicated calls and the calls that actually are for people that have a personal dislike for AI, how can this be handled better? We are using the human resources where they can have the most effect to provide the best care. And we don't, that's why we love about the working about LineIn, because it's not about selling hours, it's about providing the best service for your customers.
I will add to that, it's not only the customers, which is probably the patients, but it's also to take that pressure off the GP practices. So actually they can, because we know that demand is going up, we know that capacity within the practice are under pressure, and we know the continuity and reliability is sometimes a bit of an issue. So if we can provide that from the front end, not only do we provide better access, but we also allow the GPs and the teams to work behind the scenes more sort of with proactive care in terms of promoting that side of things. So
Absolutely. And then you also can steer all of these resources that are going to be freed by the call handling of trivial cases over the phone to be put to better use, to better care navigation, to better triaging, to all of these things that are of immense added value to the patient, and they improve their healthcare journey that AI is not yet appropriate for.
what I like about working with you as well is that you're very curious about how can we improve, and improve is very much around, but how can we get the right information? And I like that. I haven't had these questions before. I think that's interesting.
It's all about that, right? It's all about information. It's all about safety. So when you are in a, well, you know better than me, right? So when you are in a field like healthcare, you cannot guess and you cannot leave things to chance. So you absolutely need to have the safeguards in place to make sure that the bare minimum is that everyone gets a safe service. No patients would be endangered just because we want to optimize costs.
And that's how you look at it. And I look at it from, we need the continuity, because I'm then looking at the GP practices, look, well, it needs to work for them. And for them to work, it needs to be consistent what comes in. So I like that as well, that we're looking at it. Of course, I look at the patients as well, but we're looking at in both directions, not just for one.
And what I want to mention about LineIn is that you have this amazing workforce that you have trained very well, and you have spent a lot of time and effort of doing so. But there is so much velocity that you can get when you're acquiring people and when you're training them. But this partnership, what can lead to and what we can bring into the table is take this knowledge that you have and transform its impact to much greater audience than what we were doing before. So the feedback that we're getting from your phone handlers, the feedback that we're getting from your operations team is phenomenal. And this allows us to build a much better product. And it allows us to make Zaki to get just the right information, just the way that it's appropriate for the setting that it's operated. So, yeah, we're very grateful for that. And we hope that we can provide for you the vehicle to scale to the point that you can scale based on the knowledge you have acquired.
We work well in the triangle, GP, you, us. You know, it's a good triangle actually, and I like that a lot. And it can move into other aspects of healthcare. So yeah, let's see.